the YouTube link so that others can join the session and join us, in streaming as well. But we want to encourage you, if there's anyone benefit to, please share the link with them so that they can join and we can get started. Welcome once again. Just a quick reminder from one of our products, NaviHealth. Thank you very much. Over, Paul.
Hello, in this tutorial I'll walk you through the sign up process on NaviHealth. The first step is to enter navihealth.ai into your web browser. Next, click on the sign up button you can find below. Choose from one of the options to register either as a patient, facility or healthcare provider. Input your details. You can use a registered phone number or email address of choice, but please note that using a registered phone number is compulsory. Make sure to create a strong password. Once you have done that, click on the finish button to be redirected to input a 6-digit verification code. Get this code sent to your email or your phone number and click to verify the button to complete the sign-up process to get started on NaviHealth. Once the sign-up process is complete, search for a healthcare service close to your location, and once the result pops up, you can search for a facility close to your location. Once you search for a facility, you can click to leave a review on that facility. Make sure your reviews are 100% authentic and original. Input a display name which is not your profile, and thank you for using NaviHealth.
Very much. Thank you for playing that quick video. I hope that it's try and use NaviHealth. So welcome once again to Digital Mom Project. Today we are speaking on healthy nutrition during and after pregnancy. So this is the first of a two-part series. We believe that this session will be very valuable, very engaging, full of practical insights that you can take away. We're ready and we can't wait to get started. Next slide, please. Awesome. So as an overview, the Digital Mom Project is providing holistic support, comprehensive support to women, and empowering them to build their physical, emotional, financial, well-being, and very important aspects of their well-being and their healthcare journey. We believe that nutritional outcome or nutrition. We're going to take the time today to look at how Digital Mom Project is leveraging this delivery to drive maternal health improvements, across systems. So welcome once again, and we thank you for joining from Lagos, from Ekiti, wherever you're joining us from today. You are welcome. Keep introducing yourselves in the chat box. Let's get to know each other, and please turn on your videos if you can. Next slide, please. Awesome. So I spoke briefly about how Digital Mom Project is providing comprehensive support for women and financial well-being. And so these are the objectives that we are using to drive the interventions of this project. Just confirming, someone says she can't hear. All right, thank you. Next slide, please. Next slide, please. Why are we focusing on nutrition, right? What's the data? What are the numbers showing us? We see that in Nigeria, from statistics, nearly 4 out of 10 women and poor nutrition. In 2022, we conducted a prevalence study who used Complete Health, and we saw the importance of improving nutrition to be able to drive improvements in maternal health. Sorry, the slide before. All right, thank you. So these numbers, are really painted. We need to focus on diet, on nutrition practices, that will help mothers and babies achieve, whole. You can still hear me?
We lost you for a bit, but I can hear you now.
So I was just highlighting that the numbers are showing us that, the important need for driving improvements in health. And nearly 4 out of 10 women of reproductive age are affected by poor nutrition. They're either nutritionally vulnerable, or they're malnourished, or they're undernourished. Why this makes a compelling case for today's conversation. Next slide, please. Can you still hear me? I think there's a...
Very well, I can hear you.
Okay, thank you. Thank you so much. So through the Digital Mom Project, we are addressing reproductive, utilizing the real gardening solution. What's the real gardening? Real gardening is an innovative garden, a already pre-fertilized seed tape that helps everyone, whether you have gardening knowledge before seed tape, you're able to plant vegetables successfully, with even recycled water. You don't need to do anything. How to plant this garden trust, and is able to feed a family of 4 in food security in household. So it's an amazing solution. And through Digital Mom Project, we are deploying this solution. Next slide, please. All right, thank you. Okay, thank you so much. So I'm just highlighting that women who have subscribed to the Women's Wellness Program really participate in their care journey, attendance of coaching sessions, entering their health metrics, medication adherence, stand the chance to be eligible to receive these boxes, free to encourage changes. So if you're just joining us for the first time, we encourage you to sign up on Complete Health today and stand the chance to benefit solution. Next slide, please. All right, so it would really be, we can't go on today without taking the time to acknowledge and appreciate that have continued to, over the years, provide reproductive age, our members, and even healthcare workers, and the projects and the facilities that we serve or partner with. So we'd like to appreciate you. Thank you for joining us today. Next slide, please. Awesome. Next slide, please. We'd like to notify us that the Digital Mom Project, leverages the ECHO model, and so we'll be utilizing. But just not to worry, it will only be handled by authorized personnel to use to, inform continuous improvements and project design. So thank you for joining us today. We encourage you to actively participate. Questions, answers, keep the chat box buzzing, okay? Thank you very much. Next slide, please. Just confirming that you can still hear me clearly.
Yes, we can hear you. We can hear you clearly.
Lisa, we can hear you.
Dorothy, can you hear me? Just confirming. It seems like the network is glitching a little bit.
Yes, I can hear you.
Okay.
Yes,
thank you so much. Okay, thank you for confirming. Okay, so please take note, this Zoom session will be recorded, and we'll be sharing a PDF version of the slides after the session. Thank you. Next slide, please. Okay, so quick tips. We'd like to encourage you once again, please have your cameras turned on. If you need to speak, you can use the raise hand function, or you can leave a question in the chat box, and we will unmute you if you need to speak, or we can respond to your questions or comments in the chat box. But here. Many people are on standby to provide you with technical support during the session. So if you have questions, if you have experienced any glitches of any kind, please let us know and we'll provide the necessary support. Next slide, please. All right, so a quick run through our agenda today. We've spent a quick time, a few minutes just running through our welcome, introductions, and guidelines. Subsequently, we will take a pre-quiz test just to get an understanding of where we are regarding our knowledge around nutrition. Then our speaker, our guest speaker today, will share on healthy nutrition on the topic today. We'll have a question and answer session. Then we'll take a post quiz, and then we'll round up the session. So we'll go right into it. Next slide, please. All right. Just a quick, if you're joining us for the first time, it's important that we introduce to you who is MDoc Healthcare. What are we? What do we do? Why are we driven, around putting together a session like this? So MDoc Healthcare is a digital health social enterprise, and we provide self-care support for persons either living with regular health needs like pregnancy or chronic health conditions like diabetes, hypertension, and we do this by harnessing data, quality improvement, technology, and behavioral science. Our overall goal is to ensure that everyone lives healthier, happier, and more productive lives in Africa. We leverage a four-pronged approach. Next slide, please. The first of which is our Complete Health app, which has both a mobile app version and a web platform, where members will receive digital nudges, receive virtual coaching support from health coaches, to adopt the right lifestyle modifications or habits that will help them live healthier and happier lives. The next approach, please, can you change the slide, please? Thank you. Just confirm that I'm still heard. Okay. I think there's a slight lag, but just book them in your hands. You can receive virtual coaching support, and you simply have to go to the Play Store on Android. We'll put a link in the chat box as well for you to sign up if you're an Android user, or the web platform at www.mymdoc.com to sign up. Thank you very much. Next slide, please. Chiagozie, are you able to just take over briefly while I fix the technical glitch? Okwempo, please, can you still hear me? Just confirming.
Yes, Elizabeth, I can hear you.
All right, thank you so much. So may I go on, or are you good to continue?
Please carry.
This video is a brief walkthrough through our complete
Hello, can anyone hear me?
Chiagozie, yes, I can hear you.
Yes, I
Please,
can hear you.
When we play the video, and then I'll take it up from here.
This video is a brief walkthrough through our Complete Health mobile application. When you download the app, it takes you to this page, and then you can choose to either sign up or log in. To sign up, please include your first name, your last name, your email address, your phone number, and a unique password. Please ensure that the password is strong, it is unique, and it is imputed twice. After that, you can now create an account. When you click on create an account, a verification code is sent to your phone. Kindly input the verification code and your account will be active. Now you can proceed to fill in your profile. In your profile, you need to fill in your gender, your date of birth, your height, and your weight. Your height and your weight are necessary because this is required to calculate your BMI, which is your body mass index. And after that, you fill in your level of education and your income level.
So after signing up, the next thing to do is to subscribe for a program. To do this, please go to the home page and click on your name. After that, click on profile information and then click on subscriptions to the right. This will take you through a list of the available programs at MNOC. So for the purpose of this video, let's select Propel and we'll select free version and click on checkout. Checkout confirms payment and immediately takes you to fill out a BLA, which is your baseline assessment. After filling the BLA, you'll be automatically assigned to a health coach. Now, to confirm your subscriptions, please go to your homepage and click on My Subscriptions. This will show you the list of all the programs you subscribe to, highlighted in green. You can click on the programs to find out your assigned coach and also retake your BLA if you fail to do so initially. Thank you for watching this video.
Thank you so much. Thank you. Elizabeth's network is breaking up, so I would in the session. Okay, so she had highlighted that MDOT self-care support people living with or at risk of chronic health needs, and we do this through our four-pronged approach. She talked about complete health, and earlier we had directory for healthcare providers and facilities. So we'd like to see NaviHealth as the Google for Health. If you are trying to find good quality healthcare services anywhere in Nigeria, you can use NaviHealth to locate those services. View on quality of care from that facility. Next slide, please. Experience of care that you want to share, please feel free to do that through NaviHealth. Quiz, we encourage everyone to take this. Like Elizabeth had highlighted, we are not going to be assessing the individuals for this test. We're just going to be tracking the knowledge gained from the session. So to be an individual assessment of your knowledge, it's just used to track you. Confirming that can you all hear me? Can we launch the pre-quiz, please? Can you hear me?
Pulling that up shortly.
Thank you.
Yes, Shagozi.
Hi, everyone. Can you hear me?
Yes, thank you very much, Adora. I can hear you. The
Okay,
pre-test
great.
quiz is up.
Thank you. Sorry about the network challenges. As we know, the blessing and the curses of technology. Please feel free to fill out the pre-test. Like we always say, this is just to gauge where we are in terms of our knowledge on the topic. And the goal is to, as we go through this, we expect that at the end of the session, you are more informed about the topic and you're able to practice the things that you learn. So don't worry, nobody's going to penalize you if you don't know the answers now. The goal is to teach. The goal is for us to have conversations and discussions that improve our knowledge and then get us to the point where we actually then practice what we are learning. So if you're unable to see the quiz and you're using a laptop, please just scroll to the bottom of your screen and you will see polls/quizzes. If you click on that, it will pop up on your screen. If you are using a mobile device, it shows 3 dots. That's when you click on it, you can also see polls and /quizzes. If you click on that, the polls will pop up. Again, please feel free to invite your friends. This is going to be a relaxed session where we're all having conversations around healthy nutrition. So please invite your friends. It's not too late for them to join. As we learn, we all get better and we all look forward to having healthier lives and healthier families. We have 10 questions, so try to attempt, like they say in serious exams, try to attempt all questions. And again, it really doesn't matter if you know the answers to the questions or not. If you have any challenges, we have our team on standby to also support you. So please, if you have facing any challenges with your connectivity, you're not able to see the polls even after taking the direction, or please type in the chat and we will send someone to support you immediately. Okay, we see the answers coming in. We would like at least 90 to 95% of us to take this test, or this poll, like I prefer to call it. Please go ahead and answer the questions to the best of your ability. The goal is for us to learn. I see more answers coming in. Please go ahead. We would like I said, everyone to just attempt the questions. Don't worry, attempt the questions. And for as many of us who are sending out the messages, please feel free to let your friends and family and your colleagues know that we're also streaming on YouTube. So if they prefer to join the session via YouTube, that is fine as well. We'll put the link in the chat so that you can quickly forward it to your friends and your family members. Okay, hi team. I see Ngozi Anyanwu says she can't hear anyone. Can you hear us now? Can someone please help support to make sure that her speakers are on and her mic is working? Okay, I don't think her speaker is working from what I've seen. So we'll send you a message and we'll support you so that you can hear us. Thank you, Dorothy. Yes, we're almost there. We have 1 minute more before we stop the pre-quiz. So please hurry up, hurry up, hurry up. You have 10 questions. So it means you have about, how many seconds do we have in a minute? 60 seconds divided by 10. So we have 6 seconds now for each question if you're already responding to our questions. Please support Lewis. Please support Lewis to access the quiz. It's still up. Kindly post the link in the Zoom chat, please. Okay, so we have 30 seconds and I will be closing the poll. 30 seconds. Hurry up, hurry up, hurry up. Hurry up. So like we say in Nigeria, this train will not leave you. Let's hurry up. If you have started, please complete it. If you are yet to start, you still have time. You still have time. Okay, I see some answers coming in. I will start my countdown soon. Just giving room for other people to respond or for those who have started to finish. If you're just joining us, we are currently taking the pre-quiz. This is to allow us to know where we are in terms of our knowledge on the topic. And then we go through the topic, we go through the conversations and discussions, and we'll take a post-quiz. By then, everybody on this call will be a guru when it comes to healthy nutrition, and we'll be able to take the post-quiz and ace it. Okay, the countdown begins. We have 10 seconds. 9. This is the slowest timer ever. 8. 7. This is just for as many people as are filling out to complete it. 6. 5. 4. 3. 2. And we will end the polls now. Thank you to everyone who attempted the questions. Please pay attention as we go through the presentation, and please make sure you come with your questions. You can put them in the chat. You can, if we have time, we would give 1 or 2 people a room to unmute themselves and ask their questions. If you have contributions, if you have real life experiences that are relatable to this conversation, please feel free to share. We will be introducing our speaker shortly, and we would also be interjecting from time to time on how many minutes is left. Thank you so much. Elizabeth, are you able to take over?
Can you hear me?
Yes, we can.
Yes.
Okay. Okay. Thank you so much. Just a quick thank you, Adora, for assisting with the period when we had that lab. Give me a second to try and pull up on my screen because, okay. All right. Right into it. It's time to bring up our speaker to insights and guidance on today's topic so that we can all learn together first ourselves on the subject. So quickly reading her bio. So today's session we take PK, who is a seasoned registered. Yes, please. Can you hear me?
Yes, I think there's a little bit of a break. You might want to check your connection again, but can you hear me clearly? Please, if you can you give a thumbs up?
I can hear you.
Yes, I can.
Okay, so maybe I'll just introduce Mary whilst you try to reconnect, if that's okay.
Perfect.
Okay, great. All right, so our speaker today is Mary Ogwike. She's a seasoned registered dietitian nutritionist. She has a first class in nutrition and dietetics. So you know that we're serious about who is coming to talk to you today. She's lived this experience. She has the training, and she'll be coming from a relatable standpoint as well. She has over the years, she has focused on utilizing evidence-based nutritional strategies and counseling to empower individuals. So that's exactly what she's doing today, something she has done for a number of years, using the evidence that exists, and of course, her practice to empower us on this call around managing our health. She has worked in renowned institutions like the National Orthopedic Hospital in Enugu State, and she has also worked with the University of Nigeria Teaching Hospital, also in Enugu State. She's an active member of the Dietitians Association of Nigeria, and she's committed to upholding the standards of professional excellence in this field. She's currently serving as one of our nutritionists here at MDoc, and so she engages with a number of our members. I'm sure some of you on this call will probably recognize Mary because she has spoken to you once or twice. And she's also a fitness enthusiast, so she's going to be infusing some of that passion even in the conversations that we're having today. And she's very happy to teach people about both the power of exercise and the importance of healthy nutrition. Ladies and gentlemen, please a round of applause for our speaker today, Mary Ogugwe. If you do not clap, she probably will change her mind. So please, we want to see the applause in the chat. We want to see the applause on your status as well. I don't know if Mary can still hear us. Hi, Mary. I saw her video a few seconds ago. Just making sure that technology isn't also messing with her. Hi, Mary. If you can hear me, can you respond? Hi, team. Can someone please check to see that Mary's connection is also not giving any challenges?
I'll check that.
Okay, thank you. In the meantime, whilst we check that, I'm sure we're all used to the things that's the internet and technology does to us. In the meantime, I just have a quick question because I'm really curious about this topic. And please, again, this is not to put anybody on the spot. It's just for us to have the conversation. We're all here to learn. And so I just, when the words healthy nutrition comes to you, what is the first thing that comes to your mind? If you want to unmute to speak, please feel free to raise your hand. Or if you want to type in the chat, that is also fine. What is the first word? Without overthinking it, what's the first word that comes to your mind when you hear, oh, we're going to talk about healthy nutrition? Someone said balanced diets. I've not heard that term in a long time. Okay, I think I see Oluwa Sheyi. Sheyi, please go ahead. Tell us what is the first thing that comes to mind.
Same thing you mentioned, balanced diets.
Balanced diets. It takes me back to primary and secondary school. Food and its health benefits. Oh, that's a nice way to put it. That's a nice way to put it. What comes to mind for me? I would say what comes to mind for me, but let me finish. Let's see as many people as fruits and staying hydrated. Oh, wow. That's interesting. Maybe by the time I tell you what came to my mind, you people would exit me from this group. Any more responses? We have protein, chicken, and fish. Any more responses? What comes to mind? What's the first thing that comes to mind when you hear healthy living? Keep them coming. If you want to speak, please feel free to raise your hand and we'll give you a chance to unmute and speak. Calories, yes. Eating right. Let me tell you what comes to mind for me. In fact, the first thing that came to mind was wahala for foodies. That's what came to me, like wahala. If you like food, wahala. So today, Mary will tell us if it is really wahala. Balanced diet, nutritional value, meals. You people are very on it. So investment in health. Wow. Portion control. I guess I'm the only person who saw it as a threat because I already started seeing it as wahala. Calorie deficits. Wow. Any more? Any more takers? Healthy eating. You guys are just on it too. So no food is like me that think there's problem. Once they start telling us healthy eating, it means everything we like goes out the window. We start eating grass and all. Knowing what to eat and when to eat. That's great. I think I see Mary. Mary, can you hear us?
Yes, I can hear you. Can you hear me?
Okay. Yes, wonderful. Welcome back. So we will hand the mic. Sorry, somebody just said my son said breast milk. This is the perfect answer. This is the perfect answer. Welcome back, Mary. So over to you. We will interject from time to time just to let you know how many minutes you have left, because we do want to give time for people to ask their questions and make their contributions. Thank you so much. Over to you.
Thank you very much. Hello, everyone. I hope you're all excited to be here. So I want to encourage everyone to participate in this session because a wise man once said, in learning you will teach and in teaching you will learn. So whatever you learn here today, you'll be able to pass it on to your sisters, to your cousins, even to your wives and your children. So can we proceed? Okay, so we're going to be talking about healthy nutrition during pregnancy and postpartum, which is also known as after nutrition, after you delivered your baby. So healthy nutrition is different when you say nutrition and healthy nutrition. So we're going to talk about healthy nutrition, like that's the specific nutrients that you need to be healthy and to also make your baby healthy. So this is the summary of what we're going to be talking about today. We're going to learn about what nutrition is, the role of nutrition during and after pregnancy, the essential nutrients you need during pregnancy, and then hydration, because water is also important. I think as food is important, water is also important. And we're also going to be talking about the benefits of exclusive breastfeeding. So if you are ready to start this session, can you signify by typing in the chat box? I've not seen anything. I hope you all are ready to start this session. Okay, someone said I'm ready. Very good. Thank you very much. Okay, can we proceed? Next slide, please. So what is nutrition? I'm sure some of us, in fact, everybody here should have had the term nutrition. And I'm sure that most of us knows what nutrition is. So nutrition is the process by which our bodies obtain, that is when we eat food. That is how the body obtains nutrition, when we eat. And make it of nutrients from food, whether liquid or solid, for growth, development, and overall health. Now, nutrition plays an important role in every area of our lives, because it influences our energy levels. I'm sure when you've not eaten, I'm sure you feel weak. So that is how nutrition influences our energy levels. When you eat good food, when you eat energy-giving food, you have elevated energy levels to do work, to perform work. It also boosts the immune function by building our immunity, which protects us against diseases and infections, and it also helps in longevity. Now, the old adage, you are what you eat. How many of us have had this adage before? You are what you eat. How many of us have had this adage before? You are what you eat. I'm sure most of us, especially the elderly ones, have had that adage. Thank you very much. Now, this changes slightly in pregnancy to we are what our mothers ate. And why is that? We'll see that in the next slide. Next slide, please. Okay, so the reason why the adage changes slightly in pregnancy to we are what our mothers ate is because the first 500 days of a child's life, that is from the conception when the baby begins to form until after 6 months after the baby is born. Now, this is the most important and vulnerable period of their lives. Why? Because a baby is entirely dependent on their mother for good nutrition. So whatever you give your baby, that is what your baby is going to take, because they are still very young, they can't make decisions. So you have to be the one to make the decision. Okay, what am I going to give the baby today? This is what this baby is going to eat today. So they are entirely dependent on the mother for good nutrition. And that means that looking after yourself and eating well during this period will go a long way in giving your child the best start in life. Now, to grow a healthy baby, you need rest, a clean environment, pregnancy health care. That's why there is antenatal, and of course, a healthy nutritious diet. Next slide, please. Next slide, please. Okay, so this is pre and postnatal nutrition. Now, when you are pregnant, your body needs more nutrients than normal. Why? To support the growth of your baby and also to help you as well, because there are a lot of changes that occur during pregnancy. Now, eating healthy doesn't mean that you have to eat more calories, as that is energy we get from food, that is the carbohydrate, the protein, and the fat. No, but it means eating right. Now, pregnancy requires more nutrients besides more calories. Now, food is divided into the fats, the protein, and the carbohydrate, plus the micronutrients. Now, healthy nutrition means that your food has a combination of all these nutrients. That is the fat, protein, carbohydrates, and the vitamins and minerals. Now, I'm sure vitamins and minerals is not a new language. So can you chat and type the types of vitamins we know? Put that in. I want to see how many people know types of vitamins we have. Someone said vitamin B1, that's correct. Thank you. Vitamin A, thank you very much. Vitamin K, vitamin C, that one's the one everybody knows, vitamin C, vitamin C. Thank you very much. Someone says vitamin D, thank you very much. What about minerals? I don't mean Coke, Fanta, or Sprite. What about minerals? Zinc, thank you. This person is very brilliant. Someone said iron, thank you very much. Thank you. I have intelligent audience today. Someone said manganese. Thank you very much. Okay, so if you don't get enough nutritious food during your pregnancy, your baby could be born malnourished. And after pregnancy, it is important to focus on nutrition. Why? Because you will be breastfeeding, and also to help restore your body to the way it was before you became pregnant. Now, you have to aim for a balanced diet, rich in fruits and vegetables, which will supply the vitamins and the minerals, the lean proteins, the whole carbohydrates, and the healthy fat. Now, when you have a combination of all these nutrients, it means that your meal is balanced. Next slide, please. Next slide, thank you. Now, some of us will be asking, what is the role of healthy nutrition during pregnancy? Now, good nutrition during pregnancy is crucial. It is very, very important for both the mother and the developing baby. So not just for the mother, not just for the baby. It is crucial for both parties. Now, what does good nutrition do? One, it reduces the risk of birth defects. I'm sure some of us would have seen pictures of babies that are born either small or deformed. Now, these are things that can be caused by poor nutrition. There are other factors that can contribute to birth defects, but poor nutrition can also contribute to birth defects. Now, when you take good food, when you take healthy, nutritious diet, it eliminates the chances of your baby being born with a defect due to nutrition. And it also supports the growth and development of your baby, because the baby has to grow arms, the baby has to grow eyes. I'm sure none of us want to give birth to a baby that doesn't have arms or doesn't have eyes. So you need good nutrition, you need proteins to help your baby grow and develop properly. And it also promotes healthy birth weights and lowers the risk of complications during pregnancy and childbirth, because these nutrients, they play an important role. And when they are eaten in the right amount, they can prevent all these complications and health, poor birth weights. And then it also helps the mother to replenish health, to have health and energy levels during this demanding time. Because when you are pregnant, your body demands a lot. it needs energy because something is going on. It's actively going. Pregnancy is an active something that it goes on constantly until you are ready to deliver. So as long as it is on, you have to give your body enough energy, enough nutrients to help your body to see you through the demanding time. Next slide, please. Now, it's the good nutrition is not only important during pregnancy, it is also important after pregnancy. And this is why good nutrition is important after pregnancy. Now, it helps in the mother's recovery and breastfeeding and overall well-being because a lot of changes undergo both the stretching, the expansion of the womb, the used nutrients in the body, stored nutrients. So after giving birth, you have to eat healthy for your body to get back what it lost during pregnancy. Now, it also supports healing and it boosts energy levels because you have to breastfeed your baby, you have to take care of your baby, and you need energy to take care of this baby. So you actually need good nutrition to help supply the amount of energy you need to take care of your baby. It also contributes to the quality and quantity of breast milk, meaning that when you take a balanced diet, you have food rich in carbohydrates, protein, and all the nutrients. When your body produces breast milk, it also contains these nutrients that you've taken in, and you're able to pass this on to your baby, which will help your baby to grow and develop appropriately. It also helps prevent postpartum depression, which is something that occurs sometimes too. So it doesn't happen to everyone, but sometimes it occurs. Now, healthy nutrition helps to prevent this by supplying nutrients that help to keep the brain healthy, and also it also supplies nutrients that helps to boost our mood. And then it also promotes long-term health for both the mother and the child after pregnancy. Next slide, please. Now we're going to be talking about the essential nutrients needed during pregnancy. Now, it doesn't mean that other nutrients are not important too, because somebody typed manganese, and manganese is not an option here. So it doesn't mean that other nutrients are not important. They are all important. But in this life, one thing must pass something else. So that is how these specific nutrients, they are the ones that, if you don't have them in your diet, it can cause problems. So these are the essential nutrients that is needed during pregnancy. The first one here is calcium. Now, this is needed for the skeletal development of your baby's bones and teeth. So when you give birth to your baby, I'm like, my baby's hand is very strong, the bone is very strong. What is responsible for that strong bone and teeth? It is calcium. Now we have a picture here. So can you guys type the source of calcium you can see in this picture? There's an expo on the screen, but can you type what you can see, like a source of calcium from the picture? Someone said fish. Okay. Thank you. There is another egg. Someone said egg, nuts. Thank you very much. Thank you very much. Now, the next nutrient here is the one we call docosahexaenoic acid. The short form is DHA. Now, I'm sure someone will be saying, which one is DHA again? I've not heard of DHA. But you've heard of omega-3 fatty acid, am I right? If you've heard of omega-3 fatty acid, please signify in the chat box. So no one has heard of omega-3. Okay, someone said yes, heard of it. Thank you. So at least I'm not the only one. Someone else said she has. Thank you. So what is this nutrient needed for? What is DHA needed for? It is needed for your baby's brain development and growth. And apart from that, I'm sure each and every one of us wants to have children that are sharp. You know, when they say, my baby is very sharp. And this nutrient that is responsible for that sharp brain. So if you want your child to be sharp, you need to take this nutrient when you are pregnant and even after giving birth. So when you breastfeed your baby or when you feed your baby, you keep them developing your baby's brain. Now, this nutrient is needed for baby's brain and development and growth. And it also helps you stay pregnant long enough. How? Because this nutrient, it helps to regulate uterine contractions. Now, when it does that, it reduces the risk of preterm birth. So if you're able to take these nutrients in your diet, it will help to prevent premature labor, which can, when premature labor happens, you end up giving birth to a preterm baby. So this nutrient also helps you to stay long pregnant long enough. And we have the sources in the picture as well. So can someone type a source of DHA? No one has typed a source of DHA. There is Expo. Someone said fish. Yes, thank you. Fish and seafoods in general, because omega-3 is gotten from seafood. So any type of fish you are able to get, be it catfish or mackerel or Titus, they are all sources of omega-3 fatty acids. Then the next one is protein. I'm sure everybody knows this one. Protein. What does protein do? Protein is, they are the building blocks of our bodies. These, your hands, your feet, everything, the muscles, the bone, they are all done by protein. Now, it helps to develop your baby's tissues, including the organs, everything, and blood during pregnancy. And it also repairs the breast and uterine tissue and muscles after pregnancy. Next slide, please. Next slide, thank you. And thank you very much. So the next one here is iodine. I'm sure this one is another nutrient that everybody knows, because we, each and every one of us, take iodine daily daily basis. Now, what does iodine do for you? It helps to develop your baby's nervous system, including the nerve impulses, and this helps your baby feel. Like some of us that have undergone pregnancy, when your baby is kicking and you tap your tummy to calm the kicking down, your baby is able to feel the tap, and then your baby can stop kicking because of why? Iodine. Now, this iodine helps to develop your baby's nervous system, and it also helps your baby move, the kicking. And no, it doesn't mean that when you take iodine that it will suddenly make your baby to start kicking. No, this is done by because iodine helps your body to develop the thyroid hormone, and it's this thyroid hormone that is involved in the development and function of skeletal muscles responsible for voluntary movements like kicking and movement. Now we have sources of iodine. I didn't put a source of iodine in the picture because I expect everyone to at least know one particular source of iodine. So can someone type on the comment section the source of iodine again? I put, okay, someone said salt. Thank you very much. Yes, salt is the most common source of iodine. Thank you very much. So what other source of iodine do you know? Apart from salt, everybody knows salt because we use salt every day to cook our food. Someone said milk. Someone said sodium chloride. That is salt. Okay, thank you, thank you. So the next one is fats. Now, fat is one of the macronutrients. And what do macronutrients do? They are the major sources of energy. And it is also, fat is also involved in the structure and function of your baby's organs and placenta. You know, placenta is very important because that is the medium through which your baby gets nutrients from you as a mother. Now, polyunsaturated fatty acids helps with your baby's brain and nervous system development, as well as the retina, which is the eye. So fat does more than giving you energy during pregnancy. And we have the sources of fat here. We can see the avocado, you can see the oil, you can see the nuts, you can see pumpkin seeds. Thank you very much. Next slide, please. Next slide, thank you. Another nutrient needed. This one is like orga. It's like the organ of the essential nutrients, because if a woman doesn't take this one during pregnancy, it can cause serious problem. And what is that nutrient? Folic acid. Now, why is folic acid so important? It is needed for the development of your baby's brain and spine. You know, brain is like the main component of the body. It controls the entire body. So this is why folic acid is very important, because it is needed for the development of your baby's brain and the spine. It also helps to make blood during pregnancy. Now, you know, folic acid is important in preventing neural tube defects. Now, this neural tube defect is a major death defect that affects babies, and it affects the brain and the spine, and 70% of these NDTs can be avoided with enough folic acid. So if you're taking folic acid very well during pregnancy, you've already been cut off 70% of your baby developing neural tube defects. And we have the sources of folic acid. So can someone type again the source of folic acid that you can see on the screen? It's like this one is hard, nobody's typing anything. Okay, someone said beans, thank you. Someone said plantain. Vegetable, thank you very much. Yeah, so the major sources of folic acid are green leafy vegetables. We have the avocado, we have the legumes, which include beans, soybean, we have the orange juice and fortified bread. And luckily for us, we all have these sources in Nigeria. So you don't have any excuse to say, I couldn't find any source of folic acid. They all exist in Nigeria. So you can make any choice, but variety is important. Then the next one is the iron. I don't mean raw though. Iron is a type of mineral. Now, what does iron do? It helps to make hemoglobin. And what is hemoglobin? Hemoglobin is a protein in red blood cells that brings oxygen to the tissues. And the amount of blood in your body increases during pregnancy because your baby also needs blood. Your baby is developing, the blood vessels are developing, and then the baby needs blood to fill those blood vessels because it's also a human being like you. So your baby needs blood. So iron is needed to help make your baby's blood supply. Because if you don't take in enough iron, your baby, the blood in your body will not be enough to support you and your baby. So you need adequate iron to help your body produce more blood so your baby can have its own blood and you have your own blood. Now, there is a problem that can occur if someone doesn't take enough iron. And I'd like someone to type on group chat, what is that problem that can occur if someone doesn't take in enough iron during pregnancy? Or even after pregnancy, if you don't take in enough iron, what is an issue that can occur? Someone said anemia. Thank you very much. Someone has already answered. Thank you. Someone put question mark. Yes, anemia. Thank you. Now we have sources of iron. Now we have the plant sources, we have the sources from the animal products, and they include lean meat, seafood, cereals like legumes. We have bread also that gives iron, and then the legumes as well are good sources of iron. Yes, liver is another source of iron because it's from animals. So next slide, please. Next slide, thank you. This one is another one everybody knows. Vitamin C is needed for wound healing. I'm sure everybody knows that one. But why is vitamin C needed for wound healing? And what is the function of vitamin C during pregnancy? Now, vitamin C is essential for the synthesis of collagen. What is collagen? I'm sure some of us have seen soap, collagen face soap, collagen cream, collagen night cream, this and that. Now, collagen is very important because it is a protein that is a key component in the making of the connective tissues. Now, after childbirth, the body needs to repair tissues that have been stretched. For example, the womb, the stomach, it expands during pregnancy, and when expansion occurs, the skin is stretched. Now, this collagen is needed to repair this skin that has been stretched during pregnancy. And then adequate collagen production helps in repairing these tissues effectively. So your womb goes back to the normal size, your stomach goes back to the normal size, and it becomes firm instead of flabby. And collagen synthesis also helps in the development of your baby's teeth and bone because collagen forms the structural framework of these teeth and the bones. And we have the sources of, we have a lot of sources of vitamin C in Nigeria. So can you people type the source of vitamin C that you know? There are a lot of them. Someone said orange. Thank you. That is like number one. They are all, you all listing citruses. What are other sources of vitamin C? And someone said apple. Thank you. Someone said apple. Green leafy vegetables also contain vitamin C. I don't know if some of us know that. Yes, vegetables. Thank you. Blessed already said that. Bell peppers. Thank you very much. Green foods also contain vitamin C. So it's not only yellow fruits or yellow orange foods that contain vitamin C. Green foods also contain vitamin C. And then we have the last one, which is carbohydrates. And carbohydrate is the major source of energy. That is the energy source that your body prefers, that the brain prefers. And we all have the sources of carbohydrates. In fact, the major foods in Nigeria are carbohydrates, and the sources include rice, we have the oats, yam, plantain, and corn. So I hope we've all learned the sources of these essential nutrients. So you're able to tell your siblings or your sisters or your cousins, okay, you need vitamin C, this is the source of vitamin C. You need iron, this is the source of iron. You need folic acid, this is the source of folic acid that you can include in your diet. Next slide, please. Next slide. Okay. Thank you. We are also going to be talking about hydration. We'll be talking about food. Food is not the only thing that is important during and after pregnancy. Water is also important because water is made up, our body is made up of about 60% water. So that is to tell you that water is really, really important to the body. Now, this proper hydration is important for developing the fetus, since the mother has increased water requirements as the baby develops, because you need water for blood, because blood nutrients are being transported through the blood, and blood is in liquid form. Blood is not solid. So you actually need water for blood development. And it also helps to regulate the body temperature, because during pregnancy, the body temperature is increased. Now, water helps to regulate it by cooling the body down. It also eliminates waste. It aids in proper digestion and more. Now, all of these functions are important for maintaining a healthy pregnancy and a developing baby. Now, proper hydration is also important after pregnancy, because you have to breastfeed your baby, and breast milk is liquid. So water is like a medium of transport for a lot of things, for nutrients, especially here. And then you may even need more water while you are breastfeeding. Now, the Institute of Medicine suggests a water intake of about 3.8 liters in a day. Now, this is minimum. You can take more, if you can take more than 3.8, better. Now, we are going to be talking about the tips of, like, how can I take in enough water as a mother, as a pregnant woman, as a breastfeeding woman? How can I take in enough water? So the first one is you have to listen to your body. When you're thirsty, please drink water, because your body won't lie to you. So when you feel thirsty, please drink water. You can also increase fruits and vegetable intake, because these foods, they contain water, as well as other fruits with high water content. Now, what are the types of fruits or vegetables that contain high water content? There is one fruit that contains a lot of water. Thank you. You all got it right. Someone said cucumber, someone said watermelon. Yes, they are. Both of them are fruits that contain high amounts of water. Now, you have to drink enough water to make your urine colorless or light yellow. That signifies that you are well hydrated. And also, you have to increase fluid intake during an increase in activity, because when you are active, your body burns, it expels, you sweat, and that is water leaving your body. So when you increase your activity, you have to take in enough water to supplement for the one being lost. And also avoid intense heat, because during intense heat, the body loses water faster. And then drink water after waking up. This one, at least you can practice. You can have a bottle of water at your bedside. When you wake up in the morning, you can take a glass of water to ensure that you are well hydrated. Next slide, please. Next slide. Thank you. Okay, we've talked about food, we've talked about the essential nutrients, we've talked about the sources, we've talked about water. Now we're going to talk about breastfeeding. Now, as a healthcare professional, we encourage mothers to breastfeed their babies. Why? Because breast milk is the ideal food for infants. It is safe, it is clean, it contains antibodies, which are proteins that the body makes to fight against common childhood illnesses like the flu, the catarrh, the infection like pneumonia, and also ear infections. Now, breast milk also provides all the energy and nutrients that the infant needs for the first months of life. And it also continues to provide half or more of the child's nutritional needs up until the second half of the first year, that is up until the 1 year old. Now, the World Health Organization and UNICEF recommends that children initiate breastfeeding within the first hour of birth. That is, you have to put your baby to breast at 1 hour after delivery. Because when you put your baby to breast, it stimulates the brain. It tells the brain, okay, the baby says, okay, I have arrived, or yeah, time to start making my food, time to start producing breast milk. And we also recommend that babies be exclusively breastfed. If you can, please exclusively breastfeed your baby for the first 6 months of life, meaning no food, no water, no pap, nothing, just breast milk for the first 6 months of life, because this breast milk contains all the nutrients that your baby needs in the right amount. And then infants should be breastfed on demand. That is as often as the child wants, even if it's by 2 a.m. that your child wants to breastfeed. You have to wake up and breastfeed the baby, because the baby needs that breast milk at that point in time. And then from the age of 6 months, the children can also begin to eat safe food, which we call complementary feeding. So from 6 months and above, you continue breastfeeding your baby while also including food from the other sources, from external sources. Next slide, please. So some of us will be asking, what is the benefits of breastfeeding? What is the benefits of breastfeeding? Now, breastfeeding offers benefit to both the mother and the child. So it's not just the baby that benefits from breastfeeding. Now, for babies, one, it is the ideal nutrition for infants because it contains all the nutrients your baby needs in the right amount. So there is nothing like, okay, my baby needs more carbohydrates. No, the breast milk will supply all these nutrients in the right amount. And then it enhances the immune system of your baby, because the first milk that is that the baby takes, which is called the colostrum, that is usually yellow in color. Now, this particular breast milk contains the antibodies that will help to build your baby's immune system and make sure that your baby is healthy and able to fight off all those childhood infections. And also, it prevents childhood malnutrition, including wasting, that is a low weight for height. For example, if your baby is let's say 2 months old and your baby is supposed to weigh maybe about 4.5 kg, but because of malnutrition, your baby is weighing 2.5 kg. Now, when you breastfeed your baby, it prevents this, because breast milk will also provide proteins in the adequate amount to prevent wasting. And it also protects the child against infections. Now, for the mother, the number one benefit for the mother is that it lowers the risk of breast cancer and ovarian cancer. Now, how does breastfeeding lower the risk of breast cancer and ovarian cancer? Now, I'm sure some of us know that breastfeeding is like a natural family planning method. Now, when a mother breastfeeds a baby, it actually reduces it lowers the hormone, that is estrogen. And breast cancer and ovarian cancer they are influenced by estrogen. Now, breastfeeding lowers the levels of estrogen in the body of the mother, and that way it can lower the risk of developing cancer. And also, breastfeeding as well helps to mature the breast cells, making them less prone to cancer. Now, breastfeeding also helps the mother lose weight. I'm sure some of us, some people will say, I want to lose weight. After giving your baby is still 1 month old and you want to lose weight. No, if you want to lose weight the healthy way, please breastfeed your baby. It will help you to lose weight, because when your body produces breast milk, it uses energy. And all those extra stores you have in your body, your body will make use of them to produce the breast milk. So please breastfeed your baby and you will lose pregnancy weight faster. Now, breastfeeding also saves your time and money, because it's natural, it's nature's free gift. You are not buying breast milk, your body produces it. So that way it saves your money, and it also saves you the stress of having to go out to look for food for your baby. And then it also helps increase more bonds between the mother and the baby, because when you are breastfeeding, your baby is always close to you. So if you are able to breastfeed, please do so. It offers a lot of benefits. Next slide, please. So thank you everyone for joining this session. I hope that by now you have enough information. We are well equipped to pass the information on to your sisters, to your cousins, to your wives, and you're also able to help them make informed choices and tell them about the sources and the essential nutrients needed that can help them and help their improve their health condition and also their babies as well. I'm sure you're able to do this now. If you're able to do that, please signify in the comment section. If you've learned something today that you're able to pass on to people around you, your friends and your families, please do that in the comment section.
Yes, thank you so much, Mary. I expect to see us, clapping and actually thanking Mary for the very informative, very enlightening session. The real examples that we learned, very practical tips, from hydration, from the importance of hydration to, certain essential nutrients, iron, iodine, and the very everyday food, sources that we can get these nutrients from, and the importance of breastfeeding. This has been very enlightening. Your sisters, your cousins, your family members to the third generation will benefit from this session. Thank you, Mary. This has been so wonderful. Well done, well done, well done. And thank you for everyone for listening and participating. Your questions, you'll get answers to your questions. Thank you. Please keep them coming. We'll just quickly, because we're running quickly out of time, we're just going to go to the next slide to take these questions. I'm just going to try and run through. I think, Mary, we have one question here. What about nursing mothers that their breasts, they're not lactating well, so their breast milk flow is affected? What about those? What advice or what tip can we give such mothers? Mary, I think that your mic is muted. Are you able to?
Yes. Can you hear me now?
Yes, we can hear you.
Yes, so there are specific foods that can actually help to boost the breast milk. For example, pap. I'm sure the person that asked this question, I'm sure you know pap. Now, pap is one food that can help boost the breast milk production, and also fenugreek as well. These are specific nutrients foods that can help to boost the breast milk production, and oats as well. So you can try any of these foods and see which one works for you.
Thank you very much for that practical answer. So pap, oats, are some of the quick wins that mothers who are struggling with lactating can use to increase production. So another question here, there's this saying that pregnant women should not eat pineapple, or I've even heard in some cases drink zobo during their first trimester because it can induce labor. How true is that?
Yes, it's true, because pineapple, zobo, they contain they are able to help the body produce these prostaglandins that can induce labor. So pregnant women are advised to at least defer from eating those fruits while they're pregnant, because they can actually help to induce labor.
Okay, speaking about inducing labor and premature birth, another question here. Someone asked, what was the nutrients you mentioned can be taken to prevent premature birth?
Okay, that's the DHA, docosahexaenoic acid, which we all know as the omega-3 fatty acids gotten from fish, seafoods. Yes.
All right, thank you. So DHA, aka omega-3 fatty acids. Okay, we can't forget that, right? Thank you so much. One more question. I gained a lot of weight during my pregnancy, and now that I'm breastfeeding, I often feel very hungry. How can I satisfy my cravings while still losing the baby weight? So it's like a balance. What's the advice for this question?
Okay, so the advice is to eat healthy. If you're able to eat the macronutrient, that's a combination of the vegetables, because vegetables will help you to lose weight. It reduces the amount of carbohydrates or protein that you have to include in your diet. So you have to create a balance between the carbohydrates, the protein, and the vegetables as well. So this will help make sure that you are actually giving your baby the right nutrients while also limiting the amount of calories that you consume.
Thank you. Very profound, very practical, balance there. Thank you so much. One more question. At what month should a pregnant woman take calcium? At
Okay,
what month?
calcium at what month? It's expected that it's recommended that you start taking these nutrients before you even become pregnant. Because, for example, if a woman doesn't know that she has low calcium levels and then she becomes pregnant, because the baby needs calcium to develop the bones and the muscles and everything. When the mother is low in calcium, the body can leach calcium from the mother's bones and give to the baby, and that can make the mom to have low density. The bones become low density, and then it can make the mom successful to easy breaking, like that easy fracture. So it's recommended that you start taking calcium and all these essential nutrients before you even become pregnant to ensure that your body has enough amounts to give to your baby while not stressing you as a mother as well, or taking your own source to give to the baby.
That's amazing. So pregnancy, the preparation even starts even before, preparing your body and your body's capacity as well. There's one question here around, because we are receiving questions, from around those who are also streaming. What foods can I consume to control high blood pressure in my pregnancy when I'm 8 months gone?
Okay, so there is something we call dietary approaches to stop hypertension, and these include foods from whole grains like rice, oats, and then we also have the vegetables, green leafy vegetables. They are good sources of potassium. The way sodium increases blood pressure, what potassium does is that it regulates the blood pressure. So if you're able to take in sources of potassium, which includes green leafy vegetables, we also have the avocado, we also have sweet potatoes. Now, these are specific foods that can help to regulate your blood pressure. And also limiting the sodium and including spices as well. Like we have the garlic, we have the ginger, because these offer what we call protective nutrients that can help to regulate the blood pressure.
Thank you so much. So we're going to go right into our post quiz. I believe that after this very enlightening, engaging session, we have learned, so everybody has taken a course on healthy nutrition today, both for pregnancy and even for other women of reproductive age. So we're going to quickly dive straight into our post-test quiz. Remember that Adora at the beginning had said, just attempt the questions. It doesn't matter. Nobody's going to penalize you. So now that we have gained knowledge, we want to see what we've learned so far. So we're going to launch the polls in a few seconds, and then we will go. So just confirm if you are able to see the poll. Please, you can start to take it now. If you have any technical glitches, please let us know. We'll provide support to you in the chat. If you're using a system or a phone, you can just go straight to the bottom of your screen. You'll see 3 dots, click on it, and then you can access the polls. We encourage everyone to participate in the polls. Just attempt the questions. Thank you so much. Thank you for your answers already coming in. Well done. I expect the answers to be rushing in now, because now we have so much information and knowledge on nutrition. So we're seasoned, right? So thank you, everyone. Please keep your answers coming in. Thank you for attempting the questions. If you took the pre-test quiz, we encourage you to make sure you take the post-test quiz as well. Okay? Don't worry, your answers are anonymized, but it'll be very helpful for us to track and measure knowledge gain. So we encourage everyone, please make sure you take the quiz. Thank you for your answers. I can see them coming in already. Please keep them coming in. You're doing well. Well done. At the end of the post-test quiz, our speaker will provide the answers to the questions so that we see, what the correct answers are to each of the questions. So don't worry about the results afterwards. Thank you so much. Okay, I can see more and more people sending in their answers already. Please keep your answers coming in. If you're just joining us, we're taking the post-test quiz. Especially if you took the pre-test quiz, we encourage you, please make sure that you participate in the post-test quiz. After our speaker's presentation, we've learned a lot about healthy nutrition, and we believe that you are now well equipped to answer this question. So please keep your answers coming in. Thank you so much. Thank you, thank you, thank you. Well done, everybody. Have just a few minutes to go. So we encourage you, please try to participate in the post-test quiz so that we can bring the post to a close. Thank you to everyone who has answered so far, who have sent in their answers, their responses. Please keep them coming in. We appreciate your participation and your engagement from start to finish. Well done, well done, well done. If you're just joining us, we're taking the post-test quiz. Please participate and attempt to provide answers following what we've learned, the amazing learnings we've gained about healthy nutrition today. We encourage you, please, take part in the post-test quiz. This will be very helpful for us to measure the knowledge we've gained today. Thank you, everybody. We're doing so well. We're doing so well. Please keep your answers coming in. Almost there. We are almost there. Just a few more minutes. We want everyone who has started to make sure that it completes before we bring the polls to a close. So please make sure that you respond to the polls. Two more minutes to go. If you are taking the post-test, we're waiting for you to round up. So please keep your answers coming. Make sure that you finish giving your answers. Thank you to everyone who is joining back. I know that network has been really funny today, but thank you if you're just joining us back. We're taking the post-test quiz. Please hurry and participate so that we can get your response as well, particularly if you took the pre-test quiz. It's very important that you also take the post-test quiz. Well done, everyone. We're doing so well. All right, just a few more persons. We can see that a few more persons are completing. So we're waiting for you to send in your final answers so that we can bring this to a close. All right. I know I gave 2 minutes more earlier, so I'm just going to give the last 30 seconds for everyone who's sending in their answers so that your answers can quickly come in before we push for a close. Want to appreciate everyone who has taken the pre-test quiz and the post-test quiz. Thank you so much. We've done great today. Well done, everyone. We have 15 seconds to go. We're waiting for you. Please send in your answers. All right, so we're going to end the poll and bring it to a close right about now. Thank you so much, everyone, for your participation. We're just going to really take the answers to the questions now so that our speaker can provide the answers for us. Okay, thank you so much. So quickly, we'll just go straight into the questions. The question 1, which of the following statements best describes the role of nutrition in our lives? A, nutrition only affects our energy levels. B, nutrition is the process by which our bodies obtain and make use of nutrients from food for growth, development, and overall health. C, nutrition has no impact on immune function or longevity. D, the saying, we are what our mothers ate, suggests that our diet has no influence on pregnancy outcomes. Mary, the correct answer is?
B.
B. Thank you so much. So I believe we all heard that from our presentation. Nutrition is the process by which our bodies obtain and make use of nutrients from food for growth, development, and overall health. Next question. Which of the following statements correctly describe the role and sources of essential nutrients during pregnancy? A, DHA is needed for wound healing and can be found in fruits and vegetables. Remember DHA? DHA, aka omega fatty acids. B, vitamin C is important for brain development and growth, and its sources include fish, milk, and eggs. C, calcium helps develop the baby's bones, teeth, muscles, heart, and nerve function, and can be sourced from milk, yogurt, tofu, and nuts. D, DHA helps develop the baby's teeth and bones, and its sources include red and yellow peppers, cabbage, and citruses. So what's the correct answer, Mary?
C.
C, calcium. Remember that she emphasized on calcium a lot, the importance of calcium. Calcium helps develop the baby's bones, teeth, muscles, heart, and nerve function. And in fact, every pregnant woman is expected to start taking it before pregnancy, okay? Number 3, why is folic acid important during pregnancy, right? A, it's the major source of energy for the mother. B, it helps make blood, supports brain and spine development, and prevents neural tube defects in the baby. C, it can only be obtained from animal sources. D, it is not necessary if you eat enough carbohydrates. What's the correct answer?
B.
B, it helps make blood, supports brain and spine development, and prevents neural tube defects in the baby. Remember, she emphasized the importance of folic acid and the many places we can get it from vegetables. You remember that. Number 4, why are the first 500 days of a child's life considered the most important and vulnerable period? A, because it's the time when the child learns to walk and talk. B, because during this period, a baby is entirely dependent on their mother for good nutrition, and it sets the foundation for their future health. C, because the child starts school during this time. And D, because it's the period when the child gets their first vaccinations. What's the correct answer, Mary?
B.
B, during this period, a baby is entirely dependent on their mother for good nutrition, and it sets the foundation for their future health, bone development, all of that. Number 5, why is it important to focus on eating a balanced diet during pregnancy? A, it allows you to eat more calories than usual. B, your body needs more nutrients to support you and the growth of your baby. C, pregnancy requires fewer calories and nutrients than normal. D, it is only important after pregnancy for recovery and breastfeeding. The correct answer is
B.
B, your body needs more nutrients to support you and the growth of a baby. So it's important to eat a balanced diet, okay? Number 6, which of the following statements correctly describes the role of protein and iron during pregnancy? A, protein is only important for the baby's development, not for the mother. B, iron is needed to make your baby's blood supply and helps form hemoglobin, a protein in red blood cells that brings oxygen to your tissues. C, protein and iron can only be obtained from animal sources. And D, iron is not necessary for pregnant women since their blood volume does not increase. What's the correct answer?
B.
B, iron is needed to make your baby's blood supply and form a protein in red blood cells that brings oxygen to your tissues. 7, why is good nutrition important for a mother after pregnancy? A, it allows the mother to eat more junk food. B, it helps replenish nutrient stores, supports healing, boosts energy levels, and enhance the quality and quantity of breast milk. C, it has no impact on postpartum depression or long-term health. D, the baby does not need nutrients from the mother after birth. What's the correct answer?
B.
B, it helps replenish nutrient stores, supports healing, boosts energy levels, and enhance the quality and quantity of breastfeeding. And we spoke about the importance of breastfeeding, right? For both mother and baby. Number 8, which of the following statement best describes the importance of breastfeeding for the mother? Right? A, breastfeeding provides essential nutrients and strengthens the mother's immune system. B, breastfeeding helps the mother bond with her baby, promotes postpartum weight loss, and reduces the risk of certain diseases such as breast and ovarian cancer. C, breastfeeding has no impact on the mother's health or well-being. D, breastfeeding is only important for the baby's health and has no benefits for the mother. I'm sure we already know the correct answer to this. Mary, the correct answer is
B.
B, breastfeeding helps the mother bond with her baby. It promotes postpartum weight loss. For somebody who was asking, well, how can I reduce weight loss, right? How can I reduce baby weight, right? And it also reduces the risk of certain diseases such as breast and ovarian cancer. Last, the second to the last question, which of the following practices helps to ensure adequate hydration during pregnancy? Remember, she talked about drinking water. Drinking water only when you feel thirsty, avoiding fluids before and during physical activity, increasing fruit and vegetable intake, and drinking fluids like milk, fresh fruit juice, water, and soup. D, drinking enough fluids to make your urine dark yellow. What's the correct answer?
C.
C, increasing your fruits and vegetable intake, taking fluids like milk, juice, water, and soup. And then the last question, which of the following statements best describes the importance of breastfeeding for the child? Remember, we spoke about the importance of breastfeeding for the mother and for the child. So the question now is, which statement best describes the importance of breastfeeding for the child? A, breastfeeding is only beneficial for the mother, not the child. B, breastfeeding provides essential nutrients, strengthens the immune system, and promotes healthy growth and development of the child. C, breastfeeding should be avoided because formula is more nutritious. D, breastfeeding has no impact on the child's long-term health. What's the correct answer here?
B.
B, breastfeeding provides essential nutrients, strengthens the immune system, and promotes healthy growth and development in the child. Thank you so much, Mary. I believe that almost everyone probably got the answers correct because the presentation was very insightful, very engaging, and very informative. Thank you so much. Next slide, please, so we can quickly bring the session to a close. Can you hear me? Just confirming.
Yes, Elizabeth, we can hear you.
Okay, thank you so much. Just confirming that the slide is changing so that we can push for a close now that we've taken the post test. Okay, thank you. So we're going to take a quick reaction survey. We just want to know how this session, impacted you, and if there are other feedback or experiences that you have for us that you'd like us to take into consideration. So we are launching the poll now. Just quick 5 questions. Nothing. It won't take much of your time. Just let us know how the training, whether it met your expectations, was the material helpful, and other insights that we can gain from to drive improvements of our sessions. Thank you so much. We appreciate your responses. Well done, everybody. If you are having trouble seeing the reaction survey, please click on the triple dots at the bottom of your screen and you will see the reaction survey. Please make sure that you take the reaction survey, just 5 questions, to help us improve our sessions and deliver our sessions. Thank you so much, everyone. Okay, we are doing so good. This is just a short poll, so we're not going to take more than 2 minutes, right? We encourage everyone, please make sure that you take the reaction survey. Thank you so much. We're rounding up very shortly. Thank you for your responses. Please keep them coming. I can see how we're quickly providing responses. This is very helpful for us. Thank you so much. Thank you so much. A few more persons are still filling in, so we'll just give 1 more minute for us for answers quickly coming, and then we can push for a close. Thank you, everyone. And as you're filling this in, if you are done already filling the survey, if there are other topics you'd like us to address, please put it in the chat box. Our team will pull that information together for future curriculum design to continue providing relevant content that can empower us, women of reproductive age, mothers, to better practice the right nutritious practices, right? And improve our health and well-being. So we encourage you, please let us know. If there are topics you would like us to take in the future, please put it in the chat box. Thank you so much. All right, we're almost done with the reaction survey. We're rounding up very, very, very shortly. Thank you so much. Okay, so we're bringing the poll to a close now. Thank you to everyone who responded. We will just bring the session to a close now. We want to thank everyone who participated in today's session. Huge thanks to our speaker, Mary. Thank you for the very insightful, very practical, like I felt like from start to finish, every single essential nutrient that was spoken about, or the sources are things that we can easily access day to day, and also drive improvements in our well-being. So thank you so much for that very insightful presentation. We'd like to encourage you, please follow us on our social media platforms, Facebook, Instagram, Twitter, YouTube, and LinkedIn, to stay abreast of all our continued programs and the continued sessions we'll be bringing your way. Don't miss any of them. Stay tuned, stay connected. We have lots more for you. Next slide, please. All right, so we're going to bring Sean to with the final quick play of our video on how you can start.
This video is a brief walkthrough through our complete health mobile application. When you download the app, it takes you to this page, and then you can choose to either sign up or log in. To sign up, please include your first name, your last name, your email address, your phone number, and a unique password. Please ensure that the password is strong, it is unique, and it is imputed twice. After that, you can now create an account. When you click on create an account, a verification code is sent to your phone. Kindly input the verification code and your account will be active. Now you can proceed to fill in your profile. In your profile, you need to fill in your gender, your date of birth, your height, and your weight. Your height and your weight are necessary because this is required to calculate your BMI, which is your body mass index. And after that, you fill in your level of education and your income level. So after signing up, the next thing to do is to subscribe for a program. To do this, please go to the home page and click on your name. After that, click on profile information and then click on subscriptions to the right. This will take you through a list of the available programs at MNOC. So for the purpose of this video, let's select Propel and we'll select free version and click on checkout. Checkout confirms payment and immediately takes you to fill out a BLA, which is your baseline assessment. After filling the BLA, you'll be automatically assigned to a health coach. Now, to confirm your subscriptions, please go to your homepage and click on My Subscriptions. This will show you the list of all the programs you subscribe to, highlighted in green. You can click on the programs to find out your assigned coach and also retake your BLA if you fail to do so initially. Thank you for watching this video.
Awesome. Just to remind everyone who joined the session today, if you're not yet subscribed to on
this video is a brief walkthrough.
Please download the app. If you're an Android user, please visit the Play Store. If you use an iPhone or any other kind of phone, please visit www.mymdoc.com to sign up. Remember to please sign up to the Women's Wellness Program for women of reproductive age to access the services that we are providing, empowering moms and women of reproductive age to better manage their health. There's so many benefits. You need to sign up today, okay? So thank you very much. We will bring the session to a close now. Just a quick reminder about how you can use Navi Health to provide reviews on the experience of care at the facilities you visit, as well as also look for facilities nearby you that provide the services you need. We want to thank you once again for joining today's session. We thank our speaker. We thank everyone who participated. Thank you for your questions, your comments, your claps, your emojis, everything contributed to making today's session very, very amazing. And we can't thank you enough. We wish you a wonderful weekend ahead, a beautiful evening, and enjoy the rest of your day. Thank you so much, everyone, for joining. Bye for now.